Okay, let's have a look at Sustainable Development Goal number 3, good health and well-being. The underlying principle of this goal is to ensure healthy lives and promote well-being for all at all ages. The threat of the pandemic over the last number of years has threatened decades of progress in terms of global health. The pandemic infected more than 500 million people worldwide, led to over 15 million deaths, disrupted essential healthcare services in over 90% of countries, and halted progress on universal health coverage. Overall, global life expectancy has been reduced, immunization coverage has been reduced, there's an increased prevalence of anxiety and depression, and there's also a noted increase of deaths from tuberculosis and malaria. Nearly 23 million children missed basic vaccines in 2020 as a result of the pandemic. That's 3.7 million more than in 2019. The pandemic claimed the lives of over 115,000 frontline workers, and that figure unfortunately continues to rise. Tuberculosis deaths have risen for the first time since 2005, going up from 1.2 to 1.3 million from 2019 to 2020. Good health and well-being has 13 targets, and they deal with a very wide range of topics. I think all of which it's very easy for all of us to relate to these issues. So we'll have a look at them. Target 3.1. By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. According to UNICEF, there has been a decline of 38% between 2000 and 2017 in maternal mortality rates, so that's a positive. However, in places like Chad and South Sudan, there's a maternal mortality rate of over 1100 per 100,000, which is a long way off the target. Anyone, any idea what they might think the target at the maternal mortality rate is in Ireland? Target 3.2. By 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to as low as 12 per 1,000 live births and under 5 mortality to at least as low as 25 per 1,000 live births. In 2020, an estimated 5 million children under the age of 5 years died, mostly from preventable and treatable causes. Approximately half of those deaths, 2.4 million, occurred among newborns. This is our WHO statistics in 2022, and of course, these are preventable. Are those kind of deaths evident or spoken about or reported on in Ireland? Another point, half of all the under 5 deaths in 2020 occurred in just 5 countries: Nigeria, India, Pakistan, the Democratic Republic of the Congo, and Ethiopia. Nigeria and India alone account for almost a third of all the deaths. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. Perhaps these epidemics are not as evident in Ireland. How big do you think these epidemics are? By the end of 2015, there was an estimated 36.7 million people living with HIV or AIDS globally. In sub-Saharan Africa, there were 25.5 million people, 2.3 million of whom were children aged below 15. This represents almost 90% of the global burden of HIV among children. So a lot of countries in Africa suffering disproportionately in relation to a lot of these targets, obviously due to their poverty and lack of financial resources. Target 3.4. By 2030, reduce by 1/3 premature mortality and non-communicable diseases through prevention and treatment, and promote mental health and well-being. Non-communicable diseases tend to be of long duration and can be genetic, physiological, and environmental and behavioral factors influence them. For example, heart attack. Non-communicable diseases kill 41 million people each year, equivalent to 71% of all the deaths globally. 85% of these premature deaths occur in low and middle income countries. Target 3.5, strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Drug use is directly and indirectly responsible for almost 12 million deaths annually. Substance abuse, a very significant issue, a growing problem in Ireland, as we're probably all aware. Substance abuse, of course, has wider implications societally, and of course, that is going to have impacts on the goals themselves. We will be exploring this in more detail later. Target 3.6. By 2020, halve the number of global deaths and injuries from road traffic accidents. Every year, the lives of approximately 1.3 million people are cut short as a result of a road traffic crash. Between 20 and 50 million more people suffer non-fatal injuries, with many incurring a disability as a result of their accident. Road traffic injuries cause considerable economic loss to individuals, their families, and to nations as a whole. I think we have made very good progress in Ireland on this over the last number of years. But interestingly, in order to get people to wear seatbelts, we had to introduce legislation. I'm just going to mention that now because I will be mentioning that again, that even though the risk from not wearing a seatbelt is very clear, we actually had to introduce rules and laws and fine people to make sure that they actually wore a safety belt. And that was for a very palpable, clear, imminent potential risk of a crash. So I just think it's always interesting to think about that in relation to much more subtle risks and subtle issues that we have to deal with, like climate change. Target 3.7. By 2030, ensure universal access to sexual and reproductive healthcare services, include for family planning, information and education, and the integration of reproductive health into national strategies and programs. Investing in sexual and reproductive health has far-reaching ripple effects and payoffs for many sustainable development goals. What do you think these payoffs might be? How do you think Ireland's sexual and reproductive healthcare services compare to that of other countries? In Europe, in China, in Africa, in America? Target 3.8. Achieve universal health coverage, including financial risk protection, access to quality, essential healthcare services, and access to safe, effective, quality and affordable essential medicines and vaccines for all. Interesting that about approximately 5 billion people have access to medicine, so that means there's, well over 2 billion people who do not. Target 3.9. By 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals in air, water, and soil pollution and contamination. 2 million people died due to exposure of hazardous chemicals in 2019. That is a shocking figure. In 2020, UNICEF highlighted that there are at least 1 in 3 children, up to approximately 800 million globally, who have high blood lead levels. Most deaths due to exposure to hazardous chemicals are preventable, according to the World Health Organization. Target 3A. Strengthen the implementation of the World Trade Organization Framework Convention on tobacco control in all countries as appropriate. Tobacco kills more than 8 million people a year. Over 80% of the world's 1.3 billion tobacco users live in low and middle income countries. Tobacco use contributes to poverty by diverting household spending from basic needs, and it also has a significant impact on healthcare services. So the tobacco use has a dual sting. One is buying the tobacco, which is going to damage you, and the other one is then not having the money to buy food or other essentials. So Target 3B. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries. Provide access to affordable essential medicines and vaccines in accordance with the Doha Declaration on the TRIPS Agreement on Public Health. This target looks at addressing the huge issue of inequality in terms of developing and least developed countries having access to medicines, vaccines, and medical equipment. The The issue, of course, I suppose the most recent issue that everyone would be aware of here would be, of course, the issues in relation to the vaccines that were developed for COVID and how they were distributed. That is something we shall again have a look at in more detail later. Target 3C, substantially increase health financing and the recruitment, development, training and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. I'm sure you've heard of how difficult it is to recruit staff in the healthcare sector in Ireland. So if it's that difficult in Ireland, in a fairly developed and very well developed country, how difficult is it going to be in a developing country to do that? Target 3D, strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction and the management of national and global health risks. How do you think Ireland's situation in the COVID-19 pandemic compares to that of developing or least developed and some least developed countries? All countries show a need to strengthen capacity, but the least developed and least developing countries must be supported most. There we have 13 targets that look at a wide variety of issues: maternity, infant deaths, pandemics, health workforce shortages, drug and tobacco issues, sexual health. A lot of issues there. It's very easy to understand this goal in an Irish or regional context.